I do think it's right to make sure that our welfare system is supporting those who need it the most in the way that we intended it to. And you just have to look at the numbers. Over half of all the people who joined that group of the economically inactive last year were citing mental health or anxiety as the main reason. Now, of course, we want to get people the support and the treatment they need with those conditions. But I do think it's right that the welfare system doesn't over-medicalise, the everyday challenges and worries of life, especially because I believe very strongly in the evidence support work is good for people's mental health, right? There's increasing evidence, and you cite a range of different studies, that actually people being in work see huge improvements in their overall health and especially their mental health. So we're letting those people down if we persist with a system which at the moment is writing far too many of them off as just simply not able to work, when we know that work will be very good for them.
I just wanted to ask, Job Centre staff have already reported across the country unsustainable workloads and huge backlogs. Under this plan, they're going to have 400,000 more people to support into work. That is a lot of people. Are you confident that they're going to be able to manage that? And I have to ask as well, should Mark Menzies quit as an MP?
So let me just take the second one first. It's right that Mark Menzies has resigned the Conservative Whip. He's been suspended from his position as a trade envoy whilst the investigations into those allegations continue. For our part, I can't comment on our ongoing investigation while it's happening, and he's no longer a Conservative MP, as I said.
Could you talk a bit more about the fit notes and the changes you want to make? Who is going to do this instead of GPs? Are there professionals? What training will they get? How will you recruit them, given that there does seem to be an issue with recruitment in the NHS at the moment? And if you're going to have a more tailored service, that will, of course, take up more time and be more complicated. Isn't that going to just add to the backlog? And secondly, why did you wait so long before acting on the serious allegations about Mark Menzies?
So on Mark Menzies, I've already addressed that, and as I said, there's an ongoing investigation, so I can't really comment whilst that's ongoing. On the fit note, the broader point here, before we get into the practicalities of what we're doing, is the why, and it's just to remind everyone of what I said, right? When we went from a sick note to a fit note, the whole point was we were trying to say, hang on, there's lots of work people may be able to do, right? And we need flexibility in this gateway to focus on what people can do, not what they can't. But that hasn't happened. As I said, 94% of the 11 million fit notes last year were not fit for work, right? So this idea that we would have more flexibility, focus more on what people may be able to do, hasn't happened. And that's why I think it's right that we look at this.
Christopher Hope from GB News. Prime Minister, is this sick note culture a generational thing? Are you basically saying that Britain's got to pull itself together, get back to work? Do older people just get on with it and younger people don't want to? And can I ask you a question about the Rwanda flights? You now won't say these flights will take off by the end of spring. Will you say they'll take off by the end of the summer?
Right. So on this question of mental health, I just want to be really clear. I'm not in any way saying that mental health isn't a serious condition. Of course it is, and that's why, as I outlined earlier, we've invested a record amount in it, record amount of people getting treated for it, and it is a very welcome thing that we all can talk and acknowledge mental health issues in a way that we wouldn't or couldn't have done a decade ago. And look, if you're feeling anxious or depressed, then of course you should get the support and the treatment that you need to manage your conditions. But that doesn't mean that we should assume you can't engage in the world of work, because that isn't going to help you when all the evidence says that work can be good for your mental health. And what we need to not do is risk over-medicalising these things when it comes to the welfare system and over-medicalising what are essentially the everyday challenges and anxieties of life. But this point on young people is important, and I said it should worry all of us. The biggest proportional increase in the group of people who have become economically inactive since the pandemic is young people, right? That is a tragedy, right? It's enormous waste and loss of human potential. And so as a matter of urgency, we should be wanting to tackle that. And as I said, if you believe very strongly, as I do, that work is good for people, particularly early in their careers and life, then we must look at reforming this system, because how it's working at the moment, forget about what it's doing on the money and everything else, and it's unsustainable and bad for the economy. It is fundamentally letting these people down. if we are writing them off rather than helping them get into work, because that's probably one of the most positive things we can do for them.
You talk in your speech about removing benefits entirely from long-term unemployed who won't take a job. I mean, that could leave some people destitute. Some of your critics are going to say that that's immoral, not moral. What would you say to them? And can I ask you just quickly also about this Ofcom report today showing a large number of kids under the age of 7 are on social media. Is that acceptable? And if not, what are you going to do about it?
So, look, on this issue that you've mentioned, Jason, I think this is actually it's important we have a very clear and honest conversation about this. You know, welfare should always be a safety net and not a lifestyle choice. Right? I think that's something I believe. I think that's probably something everyone in this room believes. And we've got a situation at the moment where we've got 500,000 people, around 500,000 people, who have been on unemployment benefits for 6 months. 250,000 people who have been on benefits for 12 months. Right? At a time when we've got, thanks to our management of the economy, around 1 million job vacancies. Right? And these are people who don't have any medical condition that bars them from working. These are people who've benefited from all the support that Mel has put in place and Gillian's put in place with the skills side. So there's an enormous amount of support for these people. No medical conditions while they can't work. And yet we have, as I said, 500,000 of them who are kind of on benefits for a long time. Right? And I worry very much about benefits becoming a lifestyle choice. That is not good, obviously not good for the economy, not good for the public finances and taxpayers. It's not fair, but it's not good for those people, if you believe, like I do, that work is the best way to improve their lives. If the taxpayer is supporting you with all of the help you need, the training, the counselling, the CV advice, the skills boot camps, there are jobs everywhere, you know, your work coach should be in a position to say, hang on, at 12 months, if you haven't done the things that I've asked you to do, including accepting a job if there's a perfectly acceptable job available, then it is entirely reasonable and fair to say, well, that's that, right? Your benefits are stopping.
Chris Meyer from The Times. When it comes to mental health, Prime Minister, is what you're saying that there's an issue with the structure of the welfare system and the health service, or are you saying Britain has a broader cultural problem with the way it thinks about mental health and particularly thinks that it can only have a medical solution? And in terms of the cost of this, obviously PIP was meant to reduce costs when it was introduced. It very much had the opposite effect. How will you avoid the same happening again? Will you include some kind of explicit commitment that these reforms have to reduce the cost of the system?
Yeah, so Chris, good question. So look, on mental health, I'll probably echo a little bit of what I've said, before. Now, of course, right, this is not about changing how clinicians, doctors, nurses treat mental health, right? That is a question for them. Of course it would be. They'll make clinical judgments about the type of support, treatments, interventions that people need. No one is saying anything different about that today. What we are saying is that the welfare system shouldn't over-medicalise, what are the everyday challenges and worries of life, and end up in a situation where just because someone has a mental health condition that they are kind of automatically assumed that they can't engage in any work.
Prime Minister, you mentioned about switching the conviction of benefit fraudsters to the same way that we treat tax fraud. How many additional people do you think that's going to catch in the net? And on Iran, what message would you send to Tehran after these apparent strikes overnight? What should they do now to de-escalate tensions in the Middle East?
Look, so on fraud, what we've done, or what we will do, we've already done a bunch of things, data sharing powers that you saw the bus the other week. But the important new thing today is what we will do is bring forward a new fraud bill in the new Parliament. So, a new Conservative government will have a brand new fraud bill. Without getting into the micro specifics of it, there's a little bit of a difference and a gap between how HMRC is able to go after tax fraudsters and how DWP is able to go after welfare fraudsters, and we just want to make sure that DWP has all the same powers and tools that HMRC has. There's a range of things. There's information gathering powers, there's the ability to make arrests and seizures, but there's also introducing a new civil penalty so it can capture a wider group of people in the way that HMRC does, and the way that DWP is a little bit limited at the moment in what it can do.